Have you ever wondered why healthcare feels so broken, even as technology gets exponentially smarter? Well, welcome to This Explainer. Today, we're going to completely reframe how we view the future of medical AI. We are ditching that old, anxiety-inducing narrative of AI replacing doctors, and instead, we're moving toward a much more powerful concept. We're going to understand AI as a critical tool for managing complex biology and completely restructuring how healthcare operates. To truly understand this transformation, we have to rethink the core problem. The bottleneck in modern healthcare really isn't a lack of raw intelligence or medical knowledge. Rather, it's a massive misallocation of cognitive and institutional energy. Our absolute brightest minds are basically trapped doing the exact wrong tasks. Here is our roadmap for This Explainer. We'll be moving beyond simple prediction, overcoming the energy bottleneck, defining the energetic paradigm, managing biological transitions, and finally, looking at large energy models. Let's dive right in. Section 1. Beyond simple medical prediction and understanding biology as a dynamic system. You see, we have to start by looking at the human body itself, because human biology is definitely not a simple prediction problem. Think about it. A disease is rarely caused by just one isolated factor. Health emerges from a deeply interconnected web of your genetics, cellular processes, immune responses, environment, behavior, and aging. So a patient is never just a fixed, static data set. They are a continuously changing biological system trying to maintain stability. And this is exactly why personalized medicine requires state management. A generic treatment might produce completely different outcomes simply because two patients occupy totally different biological states. This brings us to a really crucial distinction. We are moving through distinct evolutionary stages of healthcare AI. We started with early medical data AI, which just finds patterns, and predictive AI, which estimates risks. Those models basically just ask, what disease does this patient have? But future AI, what we call biological world models, asks much deeper questions. What state is the patient currently in? What forces are pushing them toward deterioration? And which interventions will actually restore stability without causing unintended consequences? It shifts AI from a basic classification tool into a highly dynamic decision support system. Moving to Section 2, the energy allocation bottleneck. Just as biological health is incredibly complex, we need to zoom out and recognize that the healthcare institution itself is bogged down by severe structural friction. This perfectly illustrates why the system feels like it's failing. We have highly trained physicians essentially acting as data entry clerks. They spend their days on coding translation, waiting on prior authorizations, and fighting fragmented data instead of looking patients in the eye. It's literally like forcing a highly trained pilot to serve drinks instead of flying the plane. Scarce, high-value clinical judgment is being completely drained by low-value, repetitive administrative drag. Section 3, the energetic paradigm and reallocating intelligence. To solve this massive institutional bottleneck, we need a major conceptual pivot in how we apply artificial intelligence in medicine. We call this pivot the energetic paradigm. Instead of just trying to build a chatbot that can answer medical trivia, this paradigm approaches healthcare as a problem of managing biological transitions. It evaluates exactly which allocations of human and machine effort will produce the greatest increase in safe, accountable medical value. It's all about directing that scarce clinical judgment toward the exact moments and decisions where it matters most. And the new division of labor here is incredibly clear. Look at how it separates the heavy lifting of structural drag, the extracting, the retrieving of evidence, and the drafting handled by AI, from the deep empathy, judgment, and responsibility that must remain firmly in human hands. The AI handles the friction so humans can handle the healing. Section 4, managing biological transitions through the institutional loop. Let's look at how this strict division of labor plays out in actual biological reality. The cycle kicks off here with observation and interpretation. But remember, observation without proper interpretation produces absolutely nothing but noise. AI is fantastic at gathering and organizing vast amounts of patient data, but it has to be thoughtfully interpreted to actually understand the patient's current biological state. Next, we move to decision and action. AI can heavily support the analysis and suggest brilliant options, but generating a final decision, that requires human authority. Taking action without a human verifying the biological constraints can lead to dangerous clinical drift and side effects. The final call has to be human. And that leads directly into verification and responsibility. Healthcare demands a vastly higher standard than other AI fields. A useful system has to continuously evaluate whether our interventions actually worked. and if new risks appeared. Because, let's be honest, verification without clear, named human responsibility is just institutional evasion. Someone must always be accountable for the care. Closing the loop requires revision and state memory. Think of this as the system's long-term biological memory of the patient. Preserving this entire history is how an intelligent system tracks uncertainty. It allows the system to update the patient's biological model over time, learning continuously from verified interactions with biological reality. Section 5. Large Energy Models, the stack of the future. To put this entire paradigm into practice, the future of medical AI will move away from simple large language models toward large energy models, or ELMs. Let's look at how an LM is built. An LEM is built in distinct layers. Right at the foundation is the patient and institutional state layer. This is where the system tracks clinical history, current observations, available hospital resources, and, crucially, the levels of clinical uncertainty. Directly above that is the constraint and risk layer. Its entire job is to act as the guardrails. It actively manages clinical guidelines, strict privacy rules, medical contraindications, and financial limits to keep the AI completely bounded, compliant, and safe. Above that sits the energy allocation layer. You can think of this as the intelligent routing engine of the system. It calculates whether a specific medical problem just needs a simple database retrieval, a complex biological simulation, or if it's a high-risk situation that needs immediate escalation to a human doctor. Once routed, we hit the specialized intelligence layer. Here is where the actual specialized AI agents live and breathe. They work in parallel to handle the drag of documentation, medical coding, triage, and evidence retrieval, which instantly frees up the doctors to do what they do best. But sitting firmly near the top is the human authority and action layer. Ultimate clinical judgment, patient consent, and accountable intervention can absolutely never be fully delegated to a machine. This layer ensures that human agency is reinforced, not replaced. Finally, at the very end of the stack, the system loops back to the verification and learning layer. It observes the outcomes, catches errors, and updates the biological state. This ensures a completely closed loop of continuous learning for the entire institution. So, as we look toward the future, the true measure of healthcare intelligence won't just be how many trivia questions an AI can pass on a medical board exam. The real question is this: can AI help guide complex biological systems toward healthier states? Can it navigate the chaotic, dynamic reality of human biology to sustainably guide a human life back to stability? That is the true promise of the energetic paradigm.